I think the system does have a number of barriers to good transition care. The biggest barrier probably is just our geography. So in British Columbia, we're all here at the border, and our patients go all the way to the North Pole, right? So it's very different to transition a kid who's living in Whitehorse versus somebody who's living west side Vancouver. I think another barrier would be the referral systems, and of course specialists have to have a referral in their hand every 6 months. Many young adults don't have a GP that they identify with. They've moved away from their other one's retired, they never really liked their other one. And so it's difficult for them to, it's hard enough to make a trip to the specialist's office, but to make a trip to the GP's office, to get the referral, to go to the specialist's office. So in the end, I often do the referral myself, the re-referral myself, which is not really my role. One of the other barriers that we face is that there are still not enough adult endocrinologists across the province. It's getting a little bit better. The adult internal medicine endocrinology program continues to train 2 or 3 people every year who are graduating, but there is still a number of fairly large centers in British Columbia without any endocrinologists or with not enough endocrinologists. We need to let our patients know how to be better healthcare consumers so that they can look after their own needs and advocate for themselves. So we, for instance, do little things like have the patients make their own return appointments. We give the paperwork to the patients, and then they give it to their parents, but at least it helps them understand this is what a blood test requisition looks like, this is what a prescription looks like. See, talks about the refills here, and things like that. So we have formalized stages of teaching for our families with kids with diabetes, with adrenal disease, with thyroid disease, some of the other bigger categories of diseases. Our nurses have actually made templates for teaching so that we make sure we've done this, we've done this, we've done this, so that by the time the patient is 18, they should be an educated healthcare consumer that knows how to work the system and knows a lot about their own condition. So I think that the templates that we've developed, we've probably over the years stolen good stuff from other programs, and they've stolen stuff from us. Our templates, a lot of them are now online because of our provincial mandate to help educate other diabetes nurse educators, diabetes dietitians, and then endocrine nurses throughout the province. So it's been very important for us to network across the province to know, particularly for diabetes, because that's 50% of our patients, what are the other diabetes centers like, who's there, how much support is there for families if they were to go here and here and here. But you have to be willing to make more than one stab at it, because that's just the nature of young adults, is not everything takes the first time. Not everybody's really ready to go.